You know, someone in the United States dies of heart disease every 34 seconds. 34 seconds. According to the American Heart Association, it's also the #1 killer of women. So to raise awareness, we are wearing red for National Wear Red Day. Christina Kloecki, is that right? Did I say it right?
Very close.
Okay, is chairwoman of First Coast Go Red and is joining us this morning. Thanks for being here. We appreciate you.
Thank you so much for having us.
So much. Let's talk a little bit specifically about women. About 90%, based on statistics, women have one or more risk factors for developing heart disease.
Right.
But may not even be aware of it. I think sometimes we, as women and being busy, we tend to think more about our spouse and our children and maybe are not quite as good about recognizing warning signs that might present themselves.
Exactly, and that is exactly why I got involved with the American Heart Association. You know, I first sat down with them several years ago, and they brought me all the statistics, right? Women, #1 killer is heart disease. We don't know our risk factors. Like you mentioned, 90% we have at least one. Women, 1/3 of women die from heart disease. That's 1/3 of the women that we can't bear to live without. And all those statistics were mind-blowing. But then they shared with me the statistics around women delaying their health care. And that was my aha moment. I consider that my American Heart Association moment, because that was me. I had an episode, I delayed my care, ended up in the hospital for 4 nights, and it still didn't click that I wasn't taking care of myself. I was so focused on my career, being a mom, being a wife. Everybody else's needs were first. And I'm like, I don't want to be this example. I don't want to set this example for my daughters, and I don't want to set this example for all the amazing women I work with. So that's why I got involved, and raising that awareness and amplifying that message has been so critical. I've enjoyed being part of it over the last couple of years. We've had people come to us and say, thank you so much for sharing. I didn't know, and I wouldn't have gone to the hospital without this messaging.
And I want to talk a little bit about that, particularly because the symptoms that a man might experience are different than the symptoms that a woman might experience. So what would a woman experience that might be different?
We absolutely present differently, and there is a disparity of care there. Our common symptoms are chest pain, back and jaw pain, which you wouldn't think about, shortness of breath, and nausea and vomiting. So those are our key symptoms that we display.
Not the numbness, not the drooping face necessarily. I'm not saying that those aren't symptoms, but you're right. I could see that what you just described could probably be similar to an anxiety attack.
Exactly.
Right?
Exactly.
And busy, women might feel that way when they're feeling a little overwhelmed.
Absolutely.
Now you have a challenge that's coming up. I want to make sure to tell our viewers about that. Would you share the information?
Yes, so there's a couple of things right now. We are really focused on our Go Red for Women campaign. As part of that, we are challenging women to find their healthy rhythm in terms of their heart health, but also it's Heart Month, and American Heart Association is challenging every American household to have at least one family member learn CPR. Really be the beat that's gonna help your family, friends, and community. So much of cardiac events happen outside of the hospital setting, and it's so critical that as many people as possible know CPR.
And don't delay in administering the CPR,
No.
which is so important. Now, I want to thank you for your time this morning. We are continuing this conversation also coming up in just a few minutes. That's because we are going to demonstrate to you how to perform CPR, not just on an adult, but also a child, the correct way, depending upon if that person is older or if they're a baby. Stay with us for this life-saving demonstration coming up.